Let's now take a look at the 12 pairs of cranial nerves. What this means is that all these nerves, in one way or another, connect to the brain. That's different than the 31 pairs of spinal nerves that connect to the spinal cord. Now, as you know, the spinal nerves are all mixed. They contain both sensory and motor neurons, whereas each cranial nerve might vary. Some cranial nerves are strictly sensory, so all they have are sensory neurons. Other neurons are strictly motor, they only have motor neurons. And then a handful of the cranial nerves are mixed, meaning they contain both sensory and motor neurons. As you see on this slide, we give each cranial nerve a name, largely based on its function or location, and a Roman numeral. You should be familiar with both, the Roman numeral and the name. So for instance, cranial nerve 1 is the olfactory nerve. Cranial nerve 2 is the optic nerve. Cranial nerve 3 is the oculomotor nerve. 4 is trochlear. 5 is trigeminal. 6 is abducens. 7 is facial. 8 is vestibulocochlear. 9 is glossopharyngeal. 10 is the vagus nerve. 11 is known as the accessory nerve. And cranial nerve 12 is the hypoglossal nerve. This column here shows whether that nerve is a sensory only, a motor only, or both sensory and motor. And then in red, there are some mnemonics. There's a lot of different mnemonics that help you memorize the order of these cranial nerves. If mnemonics help you, go ahead and use a mnemonic. If the mnemonic is just more words you feel like you're memorizing, maybe the mnemonic isn't right for you. The classic mnemonic that has been around for years is this one here. On old Olympus's towering top, a friendly Viking grew vines and hops. So each of those words represents the cranial nerve. A lot of other books have other ones. One off the top of my mind is OOO, to touch and feel very green vegetables. Ah. Not the greatest one, pretty stupid in my book, but sometimes we remember stupid phrases. So if a mnemonic works for you, great, use it. If not, personally, I think you just try to learn the name, learn the order, but really focus in on the names of these cranial nerves. There's also a mnemonic that helps you remember whether the nerve is sensory, motor, or both. Okay, so what we're going to do is go down each of the 12 pairs of cranial nerves and look at their functions. Then at the end, we're going to see how clinically relevant learning your cranial nerves is. Meaning when you move on to the medical field, whether it's nursing, PA school, occupational therapy, physical therapy, most of those programs require you to know cranial nerves very well and know the clinical sign that a patient might have if there is damage to one of these cranial nerves. What we have here is a picture of the bottom or base of the brain. Here's the back of the brain. This would be the spinal cord coming up. This area here is the medulla oblongata. So this is all brain stem. We see the cerebrum and the cerebellum. You won't have to identify cranial nerves. That's really not one of the top things to focus on. But this does tell you why they were given those Roman numerals. Basically, they started with the most anterior cranial nerves, the olfactory nerves, and gave them Roman numeral number 1. Then the next would be the optic nerves, and they actually cross. They form what's called the optic chiasm. Chiasm means cross or an X. And that happens right about where the pituitary gland is located. Then you kind of work your way back from there. I'll also point out the trigeminal nerve, when we get to it, I'm going to mention it's the largest nerve. It's the largest when you look at it, or at least look at it where it attaches to the brain. Okay, let's begin. Cranial nerve 1 is known as the olfactory nerve. It's strictly sensory. It has no motor neurons in it. And its function is in olfaction, your sense of smell. We're going to get to special senses. That's the last chapter we do in A&P1. And when we do that, we're going to learn that there is an olfactory epithelium in the upper part of your nasal cavity. So shaded here in purple is the only area in your nasal cavity with olfactory neurons. Those olfactory neurons are known as olfactory receptor cells. So when you breathe in chemicals into your nasal cavity, we can detect some of them using these neurons. Those neurons then have to travel through little holes in the cribriform plate. Recall the cribriform plate is a portion of the ethmoid bone. So this is ethmoid bone right here. And in that cribriform plate, there are tiny little holes, tiny little foramina for the olfactory neurons to get up to what's known as the olfactory bulb. This terminal end of the nerve is just known as the bulb because it's much wider than the rest of the nerve, which is called the olfactory tract that goes into the brain. So olfactory nerve is a pretty easy one. All it does is transmits that chemical sense we call olfaction. Cranial nerve 2 is not one of the more difficult ones. It is, in essence, an extension of the retina. We're going to be talking about the retina when we get to eyes and vision. But when light enters an eye, it's going to go through a number of parts of the eye, like the lens, and it's going to hit the back of the eye where you have your retina. And that light, when it travels into the retina, it gets detected by neurons known as your rods and cones. Those are known as the photoreceptors. They're the ones that actually detect light waves. They convert light into action potentials. And those action potentials, those nerve impulses, travel out of the retina using neurons known as ganglion cells. So it's actually the ganglion cell that form the optic nerve, and then that optic nerve goes out the back of the eyeball. Parts of those nerves cross at what's called the optic chiasm, and again, that's located very close to your pituitary gland, sticking off the hypothalamus. So the optic nerve is pretty straightforward. It's strictly sensory. It's your nerve of vision. It transmits that information to your brain. The next nerve is a tricky one. This nerve you have to spend a little more time on than a lot of the other ones because it has a number of functions. Now you'll notice on this picture they've kind of grouped 3 nerves together. These 3 nerves all innervate muscles that move your eye. So we're just looking at this first one here, the oculomotor cranial nerve 3. It's a strictly motor nerve, so all it does is control things. It's got no sensory neurons in it, but it's got a number of motor functions. One is it innervates your iris, and we'll talk more about the iris when we get to vision, but the iris is that pigmented part of the eye that you see in people. When someone says they have green eyes, it's their iris. And in the center of that iris is your pupil. That's basically a hole. It's a hole in the iris. And this nerve controls the size of that iris. So it's involved in what we call pupillary constriction, causing that pupil to become smaller, typically in response to bright light. So it controls your iris. It also controls a muscle that controls your lens. And again, we're going to talk a lot about this when we get to vision. But your lens helps you focus. So if you're reading print or looking at something very close to your eyes, we need to focus on that. And that's done using a muscle in the eye called the ciliary muscle. And that ciliary muscle controls your lens. So it's very useful for focusing on small details. Then there's a number of little parts of this nerve that innervate muscles that move the eye. One of them is known as the superior rectus. It's a muscle that lies on top of the eye. It's rectus because it runs parallel to the midline of the eye. And that muscle helps to elevate your eye. It helps you to look up. It also innervates a muscle called the inferior rectus, which depresses the eye. Now, you'll notice this is in red. Your PowerPoint might have a mistake. If your PowerPoint does not say inferior rectus, you need to cross it out and put inferior rectus. That was a typo. But the inferior rectus lies at the bottom of the eye. It runs parallel to the eye. And when it contracts, it helps you depress. It helps you look down. It also innervates a muscle called the medial rectus. That one's on the medial side of the eye. And when it contracts, your eye adducts. So it moves the eye medially. The fourth muscle it innervates is called the inferior oblique muscle. Now this one's different than the other three. This one runs on an angle. And because it runs on an angle and the way it's positioned, it actually helps to elevate the eye. It helps you look up, but it also helps the eye rotate or turn to the outside. And again, this is in red because this might not be in your handout. So this inferior oblique, and we're going to go over all these muscles again when we get to eyes and how they move. But this muscle helps you elevate the eye and rotate it to the outside. Another muscle this nerve controls is the levator palpebrae superioris. If you recall, that's the thin little muscle in your eyelid that helps to elevate your eyelids. That helps you keep your eyes open. So you'll see this muscle is all motor, and it's all going to little muscles, whether the iris is actually a muscle, the ciliary muscle that controls your lens, these four muscles that help move the eyeball, and then your eyelid muscle. There's a condition called third nerve palsy, where if this nerve is not functioning, you can imagine what would happen. A, have trouble with eye movement. 2, you probably have vision problems from the inability to focus, and the pupil will be a little too dilated, so the eye might be letting in too much light. But kind of the classic sign of third nerve palsy is when the eyelid droops, because this nerve is not stimulating that muscle to keep that eye open. So this one you'll notice you're going to want to spend a little time on this one because it does a number of functions. But they're all related to your eye, and they're all motor functions. In the next video, we're going to continue with the trochlear nerve, or